Our next speaker for the evening is Dr. Zubin Marolia from India. Dr. Zubin Marolia is a holistic family physician practicing homeopathy and integrative oncology in the city of Mumbai, India. Dr. Marolia was trained at the Lucas Clinic in 1991, where his journey began and has now become one of the main proponents of mistletoe therapy in India for over 24 years. He has begun mistletoe therapy to treat patients both curatively and palliative settings. He has a vast experience in treating advanced cancer patients with subcutaneous and intravenous mistletoe therapy. He is now embarking upon his vision to apply mistletoe in a perioperative therapeutic approach. Dr. Zubin Marolia has been invited to lecture and share his integrative oncology experiences at Memorial Solar Catering Cancer Center, New York, and at Johns Hopkins University, Baltimore. He has also worked at the Filter Clinic at Medical University of Vienna. Dr. Zubin Marolia has the unique distinction of attending and presenting his work in integrative oncology at all the previous IMM meetings 2012, 2014, and now we are happy to welcome him again at IMM 2016. Dr. Marolia will present the relevance of apoptosis in palliative cancer treatment. Dr. Marolia, welcome.
Thank you, Dr. Roy, for all the kind words. A warm namaste from India and warm greetings and best wishes from my country. It's an unenviable task to talk at the fag end of a conference on the first day. I'm sure all of you must be quite tired and exhausted with all the lovely presentations. So I talk on a topic that has taken my interest in the last few years after I left the IMM in 2014, where I spoke on healing stories. Many of you were over here and I spoke on the aspect of every patient having a healing story. And so important it is for a physician, especially in a disease like cancer, to know the healing story. So I begin my talk, the relevance of apoptosis in palliative cancer treatment. Adding life to days and not days to life is the goal of every physician, every practitioner, every therapist, every family member when you encounter a cancer patient. Why do cells die? Cells die because they are no longer required. They need to be replaced as they have reached the end of their useful life, or they become damaged or infected. Some cells, like neurons, can live throughout the life of an organism, while neutrophils only live a few hours, as we all know, before they are replaced. What happens to a cell when a cell is damaged? Do you repair the cell or a cell dies? That's the main question. Cells suffer injury in the course of their life. They are an array of sensors that can register damage within the cell and can either recruit the necessary enzymes, repair enzymes, or if the injury is severe, can initiate a form of programmed cell death, what we call apoptosis. These intracellular sensor molecules play an important role not only in detecting damage within the cytoplasm, but also at the plasma membrane and within the nucleus of a cell. The importance of these damage sensory and repair molecules for normal cellular function is highlighted by the fact that these molecules are frequent targets for mutation during the progression to a malignancy. Research in the field of cell death has revealed how defects in cell death regulation can contribute to the development of a malignancy. Genes involved in the regulation of cell death are targeted for mutation during the course of a developing malignancy. That's why these molecules become doubly attractive as potential targets in cancer therapy. As we all know, there are two types of cell death regulatory molecules: cell death inducers, which facilitate apoptosis. For example, the DNA repair protein P53 or cell death repressors which block or delay apoptosis, like BCL2. Death and division is a balancing act. So in this diagram, as you see, in diagram A, you see there's equal cell division and cell death, and the cell population is maintained at an equilibrium. In diagram B, you see more of cell death and less of cell division. Unregulated cell death, which leads to population contraction. And in diagram C, you see more of cell division and less of cell death, which leads to a population expansion like a cancer. Apoptosis. Until recently, cancer was thought of as a disease of cellular proliferation. Latest research shows that cell division and cell death are intimately linked. Dysregulation of either one, as occurs during cancer, necessarily involves the other. Cell death was believed to occur by degeneration or necrosis many years ago. As early as 1940, Glucksman had recognized that cell death plays an integral part of embryogenesis. That's the palm. So the limb bud developing, and the cells between the fingers undergo apoptosis for the fingers to be formed. Apoptosis is a process whereby a cell, upon receipt of an appropriate stimulus, engages a set of molecules that cooperate to dismantle the cell from within. The process culminates in the separation of the cell body into many intact pieces called apoptotic bodies, maintaining membrane integrity. And that's very, very important. You will see in the coming slides how important it is for the membrane integrity. An alteration of the composition of the plasma membrane of the apoptotic cell attracts the attention of nearby phagocytes. So this is the diagram, a very simple diagram wherein you see a normal cell, and here the cell undergoing the entire cycle of apoptosis, wherein the cell shrinks and the chromatin condenses. You see the membrane starts bleeding, and the nucleus and the organelles collapse, and you see small apoptotic bodies that form and present themselves to the macrophage for phagocytosis. They actually present themselves to the macrophage, a process called as efferocytosis. And here, two words that are very, very important is in apoptosis, because the whole process of cell disposal and cell debris is so clean and clear that there is no inflammation in the malignant tissue. I am dying, come and get me. These phagocytes then eat the dying cell, which is a critical point before the cell has a chance to burst open and release its contents into the extracellular space. This is very, very important. It's like a packaging process that facilitates disposal of unwanted cells by breaking them up into bit-sized pieces, and they each come with an attached label, I am dying, come and get me. And here, if you see, I have compared the features of necrosis and apoptosis, wherein you find that the cell size in necrosis enlarged, in apoptosis it reduces. The plasma membrane in necrosis is disrupted, which leads to spilling of the intracellular contents into the extracellular space, whereas in apoptosis the membrane is intact and adjacent inflammation is very frequent. In necrosis and apoptosis there is no inflammation. And here you see how in necrosis the entire cell injury leads to rupture of the cell, and the damage to the cell is so severe that the cell loses its ability to maintain cell membrane integrity, and within minutes it bursts open, releasing its contents into the extracellular space. As we know, cells contain many enzymes lipases, proteases, nucleases that can cause severe injury and even death when released in the extracellular space. So, what happens? A necrotic cell often ends up damaging many neighboring cells as a consequence of its own demise. This sets up a chain reaction of more cell deaths, followed by still more deaths. As a whole, there is a wave of necrosis and damage to the surrounding tissue. To make matters worse, all of the dead and dying cells soon attract the attention of the surrounding neutrophils and inflammatory macrophages. And these neutrophils also rush in. They expect to find a bacterial or other invasion. And confronted with this unsightly mess, they then start to add to the general mayhem by releasing the toxic enzymes which are normally used for killing bacteria, thereby adding to the carnage of the malignant tissue. Here you see, apoptotic cells are eaten before they can release their contents into the extracellular space, so damage to the neighboring cells is largely minimized. So here you see the intact membrane, and here you see the spillage of the contents causing inflammation, which results in discomfort and pain, as you will see in my next slide. Mistletoe. A journey I began in 1991 at the Lucas Clinic, and I'm with you before now in 2016. So mistletoe extract seems to induce apoptosis via activation of death pathways, possibly through activation of caspase 8 and subsequently activation of other cascade of caspases. Some studies over here in which we have a correlation of immune cell activities and beta endorphin release in breast carcinoma patients treated with lectin standardized mistletoe extract. Again, here we see Iscador and apoptosis. Iscador Q induces apoptosis via the mitochondrial pathway, whereas Iscador N induces apoptosis by activating the death receptor pathway. Inflammation is one of the most important causes of a majority of cancer symptoms, including pain, fatigue, cachexia, and anorexia. So within a malignant tumor, not only cancer cells, but also lymphocytes and other cells and neurons produce mediators that are released in the microenvironment which activate nociceptors, which adds to the pain in a cancer patient. So as we all know, cancer and palliative care, Latin palliare means like a cloak to cover. And remember, to palliative care is patient and family centered that focuses on effective management of pain and other distressing symptoms. I'm going a bit quickly, I've been given 5 minutes. So palliative care involves a holistic approach, understanding the whole person. This is a small case that I saw in India, a lady with a carcinoma of the palate which was eroding right into the right orbit with the discharge of yellowish, purulent, bloody matter, and she came to us. She was put on mistletoe and homeopathy medicines, and after 6 weeks, you see beautiful, the discharge has stopped. She found relief in her symptoms. Cicely Saunders, founder of the hospice movement in England, gave a very beautiful concept of total pain. She said that in pain, total pain, you must view the impairments, the disability and the handicaps it causes, the psychological distress and grief over loss and change, social disruption, financial, residential and family and role strains, and spiritual distress. Why is this happening to me? And why am I being punished? In palliative care, as you all know, the focus shifts from being the person with the cancer in red to the person in red with the cancer. And this is my favorite slide. I will end my presentation with this particular viewpoint. Top 5 regrets of the dying. Bronnie Ware is an Australian nurse who spent several years in palliative care caring for patients in the last 12 weeks of their lives. And she says, the 5 regrets. 1, I wish I had the courage to live a life true to myself, not the life others expected of me. I wish I hadn't worked so hard. I wish I had the courage to express my feelings. I wish I had stayed in touch with my friends. I wish that I had let myself be happier. As Mark Twain has said, life is short, break the rules, kiss slowly under the mistletoe, love truly, and never regret anything that makes you smile. Thank you very much.
Thank you so much for the interesting presentation. And now it is time for your questions. Please address them to Dr. Marolia.
Dr. Zubin, can I ask you a question?
Yes.
What are the investigations carried out to see that Ischedor M induces apoptosis in a particular way and Ischedor Q induces apoptosis in a particular way?
Yeah, that was the study that was done. I mentioned the study date and the research paper. So we had a specific research carried out by the researchers in the field of immunology.
You have it in your references?
Yes.
She mentioned some homeopathic remedies that you use along with the mistletoe.
Yes.
Is that the Banerjee remedies or what other ones?
No, I don't use the Banerjee remedies. The approach in oncology with homeopathy is always constitutional. And there are two factors which I'll take 2 more minutes, Stefan, over to answer the question. That in seeing cancer patients over the last 26 years, I've always found there are 2 S's that you should always remember. And the first S you'll see in a cancer patient is always suppression. The cancer patient will always have a suppression at any particular stage of their lives. I recently saw a case of breast cancer in a young lady, 32 years of age, and she mentioned she is a top IT analyst in a big company. And I had taken her full history, like in homeopathy, when we analyze a patient's history, and I gave her a remedy, and she comes back to me after about a few weeks. She says she's not better. So I ask her, tell me your healing story. I want to know your story. And she says that I have done everything in my life to please my father, my mother, my brother, my sister, my boyfriend, and now my husband, and now my child. I have made sure that they are happy. So I said, what do you want to do? You're an IT analyst, you're earning so much money, you're doing so well in life. And she says, I want to buy a Harley Davidson bike and go on a long mountain ride in the mountains in the Himalayas and just be there with the nature, and I want to draw and I want to paint. And it was so beautiful, and she breaks down in front of me, and I said, I think you should go and do it. Suppression. The second is spontaneity. It's very important that as you live your life, you have to have that spontaneity in you to do all the crazy things that you want. All the crazy things that you want. How many of us go and actually play on weekends? To let our hair down and to play a game of football or to play with children, and Dimitri is putting his hand down. It's so important to have that spontaneity. A cancer patient will always, you'll find that they will never be spontaneous. And that's why, because of the suppression that happens over the years, you will find a few cells break out and they become spontaneous. It is the expression in a microcosm of their spontaneity. And that's when a malignancy starts. So you will always find that the spontaneity is curbed and suppression will happen in a cancer patient. Patient that I have seen in my life and as I've gone on their journey.
Thank you, Dr. Marolia. We have another question.
I wanted to know how did you use, which type of mistletoe did you use? Did you use subcutaneous in the abdomen, or did you use it near the lesion? That was one of the questions. And which potency did you use, and which homeopathic remedy did you use in this case?
Okay. So if you can go back to the slide, I used a homeopathic remedy which I have used for cancer patients with advanced pathology, especially with night aggravation of cancer pains, is Cifilino. And in this case, I had to rush through. In this case, I've used Kali iodide 30, and she had the indications for Kali iodide 30 was thick yellowish green discharge with a perforation of the nasal septum and bony or vital tumors. So sifalinum was the intercurrent remedy and Kali iode was the pathological remedy. It was a pathological prescription. And the mistletoe was Iscador. I used Helixor M in this case, and she was on Helixor M series 1 and series 2 with intravenous Helixor once a month. After attending the 2014 IMM, I'm extremely thankful to Helixor for that meeting because there was so much of research on IV mistletoe and intratumoral mistletoe by Dr. Harald Matthias and other doctors. And after I returned back to India, I used a lot of intravenous mistletoe and with a lot of success.
Thank you, Dr. Marolia, for the very excellent presentation about particular, very clear understanding about the cytological explanation about apoptosis. Really, I'm realizing that my Korean hospital is more higher purpose, has a higher purpose in treating the end stage of the cancer, like many kinds of the metastasis. Really, I'm not happy to listen about the many kinds of focus on the palliative symptom care with the mistletoe was immune therapy. So I really hope to see the more curability for the end stage of the cancer with our all immune treatment. Particularly our patient, our hospital using the immune booster method with cocktail therapy with vitamin C or selenium or whatever. Could you share about any some kind of the good example in curable cases in the end stage of the with the many in your life or with the cases? Maybe very encouraging for that.
Yeah. Well, I have used IV mistletoe extensively after 2014. I had a case of a gentleman with pancreatic cancer. I was called home. He had taken chemotherapy in Hinduja Hospital, a top hospital in Mumbai city. He developed deep venous thrombosis. He was treated in deep venous thrombosis with homeopathy. We had given Vipera, the snake venom of the viper snake in homeopathy, and the family wanted me to treat him with mistletoe and with Helixor. And he was at home. I keep all my patients at home. It's very important to have that family-centered care. And I have that patient, a very poor patient in central Mumbai, and I was called around 10 p.m. in the night. He was in severe pain. He had the fentanyl patch, and we gave him, in the last moments of his life, we gave him 700 milligrams of Helixor intravenous, a few hours before he passed away. And another case of pancreatic cancer that I was treating, again at home, received IV Helixor, and she was in subacute intestinal obstruction, and she was still able to have and desire the drink that she wanted towards the end of her life, and that was lemonade. So there's a video of her sipping lemonade towards the end stage. So even a few hours before a patient dies, I use a lot of IV mistletoe. And that's thanks to Helixor and thanks to the lovely IMM we had in 14 that I was encouraged to use it in India.
Okay. One more question.
Thank you very much for this very nice presentation about necrosis and apoptosis. There is another idea, why there is necrosis is the question actually. Is it not oppositely that the extracellular matrix affecting the cell, because we always focus on the cell, that it is damaging the extracellular matrix and bringing the inflammation inside, but maybe because of our food, sleep and habit, we will change our extracellular matrix. That's why the cell will become destroyed and necrosis. And then we have this reaction. The cause can be also can be seen from the other side maybe, or what is your opinion on that case?
You have a very important point. A lot of research is now going on to the extracellular space, how it impacts a cell. But usually in necrosis, the damage to the cell is so severe that it is compelled to bring about a reaction which leads to spillage of cell contents. Whereas in apoptosis, it's a more highly regulated process, wherein the cell is able to understand the damage and then step by step lead to apoptosis. So the damage in necrosis usually sometimes is very, very severe, and that's what causes necrosis. And it occurs within a few hours. Whereas in apoptosis, it's more a controlled and a regulated process. Yeah, Kenny?
Yeah, Dr. Marolia, questions about IV that you administer to the patient, 50 milligrams that you thought, and with vitamin C, yeah, standard, right? When you do Helixo IV, when would you determine whether it is inducing apoptosis, or if the dosage is high until a level that causes necrosis? So the IV Helixo, is it causing apoptosis or the not so desired necrosis? In which level of the milligrams that would it possible for you to switch from apoptosis into inducing necrosis?
Well,
using Helixor in IV.
When you give mistletoe, when you give Helixor or other mistletoe products, you bring about a gradual stepwise induction, gradual stepwise immune stimulation. And as I mentioned, in necrosis, the damage is widespread, okay? And the cell injury is very massive, whereas in apoptosis, when you're giving mistletoe, you are giving a highly regulated stepwise immune stimulus to induce a regulated process of cell death. That's why Iscador, both the Iscador types were known to induce apoptosis in two different pathways. One was mitochondrial and one was the other one.
Dr. Zubin, thank you for your presentation. I have two questions. First, how could you connect the importance of apoptosis and the importance of life history? Because in your presentation, you talk about the mechanism and then you shift to a bigger level of consciousness. Then first, I want to go into the connection, the first question. And the second, if you think about apoptosis and mitosis, where you can have in vitro carcinoma, then for me it don't seem that apoptosis is the main problem, but seems that it's a inter-problem connected with differentiation. And from immunological point of view, you have the lack of natural killer in the place of the cancer, like a blind point in the body. You understand this from the immunological point of view? How you connect that lack of immune system and the lack of apoptosis in a whole life?
The question is too long, Ricardo, but whatever little I understand, it's a very nice point. You heard, in fact, this statement of the cell says, "I am dying, come and get me," is through the research work of Professor Seamus Martin from the University of Ireland. And he's written a book on apoptosis. And it's so beautiful that the cell is fragmented in different parts, and it's presenting itself to the phagocyte and saying with a label, "I'm dying, come and get me." And that's what happens to a dying cancer patient. The cancer patient says, "I'm dying." And so there is a bit of similarity which I see.
There's a contradiction, because in cancer we have the lack of dying in cell level.
It's the feeling of the patient, Ricardo. It's the feeling. The patient senses that he is dying, and he wants to present himself to the Almighty. That's how I view it. You come and get me. And the second question that you asked me, I'm still not very clear. Can you condense the question? The second one, when you asked about apoptosis.
We have several levels until achieve metastatic cancer. First, we have imbalance between mitosis and apoptosis. Then we have angiogenesis.
Can you be specific?
For me, the question is how the cancer developed beyond the apoptosis. Seems we need more mechanisms. Apoptosis just in the beginning. And there is a paradox, because the patient when is dying, there is excess of life,
Okay,
and lack of apoptosis.
Yeah. See, basically, you have to understand that many a times a cancer cell originates from a partially damaged cell. And a partially damaged cell, if the sensors are correct, and if it presents itself for apoptosis, which is a programmed cell death or a highly regulated cell death process, then cancer would not develop. That's why I mentioned to you in the embryological development, the digits that are formed is because of a natural process of apoptosis.
Thank you very much, Dr. Marolia. Unfortunately, the time is over.
Thank you.
Big
Thank you very
applause.
much for